With gratitude, the CLPNA acknowledges the traditional territories where we work and learn. The CLPNA regulates the practice of practical nursing on Treaties 6, 7, and 8 territories, the unceded territories, and the Métis homelands. We respect the histories, languages, and cultures of First Nations, Métis, Inuit, and all First Peoples of what is now known as Canada, whose presence continues to enrich our community and whose ancestors have taken care of the land for centuries. Welcome to the College of Licensed Practical Nurses of Alberta's video on LPN professional responsibility and accountability. In this video, we'll explore key topics related to LPN's responsibilities and accountabilities for the delivery of safe, competent, and ethical care. As regulated professionals, LPNs are accountable for their practice and behavior. They are expected to take responsibility for the care they provide and behave in a manner that is trustworthy, reliable, and professional. They are also expected to follow the legal, professional, and ethical standards of their profession. These ethical standards are covered in documents that include standards of practice and the Code of Ethics for LPNs in Canada. LPNs use these documents together with other regulatory and workplace requirements to guide their practice and behavior. In achieving these requirements, LPNs meet their accountabilities for ethical practice. The Policy on Professional Responsibility and Accountability was created by the CLPNA to support LPNs in understanding the expectations of their profession. This document covers a range of topics. In this video, we're going to focus on some key expectations related to scope of practice, professionalism, abandonment of care, professional boundaries, and privacy concerns with social media. We'll illustrate these concepts with examples of actions that are considered unprofessional conduct. Unprofessional conduct covers a wide range of behaviors. It includes having a lack of skill or judgment when providing professional services and failing to follow relevant legislation, regulations, standards, and policies. Unprofessional conduct can occur while an LPN is on duty and in some cases when they are off duty. Let's start by looking at expectations for working within scope of practice. LPNs have a responsibility to work within their scope of practice. Scope of practice is defined in the Health Professions Act, the Health Professions Restricted Activity Regulation, the Standards of Practice for LPNs in Canada, and other documents. Employer supports and an LPN's individual competence also play a role in determining scope of practice. Working outside of scope involves one or more of the following: performing activities that aren't authorized in regulation, performing activities that the employer doesn't support, or performing activities outside of the individual LPN's knowledge, experience, skills, and abilities. Let's look at an example of working outside of scope of practice. A new LPN is working at an assisted living facility after graduation while still holding a provisional registration practice permit from the CLPNA. He accepts an overnight shift where he is the only LPN on duty. He is responsible for supervising a small team of healthcare aides. During the night, the LPN notices that a client's catheter is bypassing. He performs a suprapubic catheter reinsertion per a medically approved protocol. However, the LPN had only ever performed this activity in a classroom setting. As a provisional permit holder, the LPN in this scenario was not allowed to work unsupervised or supervise others. Therefore, he needed to decline the shift and clearly communicate his limitations with the supervisor. The LPN also performed a catheter reinsertion despite not having the necessary experience or supports in place. Catheter reinsertion is considered a restricted activity. Provisional LPNs are not authorized to perform restricted activities without supervision. Therefore, this LPN needed another, more experienced health professional to supervise him in performing catheter reinsertion. For more information on provisional permits, see the CLPNA's policy on provisional registration. For more information on scope of practice, you can read the CLPNA's Determining LPN Scope of Practice guideline. Now, let's look at an LPN's responsibilities regarding professionalism. Professionalism relates to the behavior, skills, and qualities that an LPN is expected to demonstrate. Professionalism involves LPNs using the nursing knowledge that they gain through education, training, and experience to guide their practice. It includes applying critical thinking and clinical judgment as part of evidence-informed decision-making. Professionalism also involves communicating effectively, honestly, and respectfully. This includes working within the healthcare team, using appropriate documentation, maintaining client confidentiality, and prioritizing the needs of the client. Let's look at an example where an LPN failed to demonstrate professionalism. An LPN was present when a client fell. Before the client was safely back in bed, the LPN went to answer a call bell in another room. She delegated the post-fall assessment to the HCA who was present. Later, the LPN documents the incident. She indicates that she performed the assessment herself, but she provides only vague details on the injuries. This results in insufficient follow-up for the client and inaccurate information being shared with the healthcare team. In this example, the LPN failed to demonstrate professionalism in a few ways. In all situations, LPNs are responsible for using their critical thinking and clinical judgment. When falls occur, LPNs need to prioritize completing a post-fall assessment in accordance with employer requirements. Performing assessments is not within healthcare aid scope of practice. Therefore, the LPN needed to complete the assessment herself. She could have instead assigned the healthcare aide to answer the call bell. The LPN also provided false documentation by recording the post-fall assessment as though she had completed it. This dishonesty is a clear breach of ethics and professionalism. The LPN's actions also go against expectations established in the Code of Ethics and Standards of Practice, which state that LPNs have a responsibility to only document the care that they provide. In this incident, the LPN displayed a clear lack of accountability and integrity. When errors happen, they need to be communicated quickly. By covering up her mistake, the LPN may have negatively impacted the care her client received. Next, we'll cover the topic of abandonment of care. The duty to provide quality care is fundamental to professional nursing practice. LPNs need to be competent and able to complete any care assignment they accept. Once an LPN accepts a care assignment, they are required to be readily available to provide the agreed-upon care to the client. If this cannot occur, for example due to a break or end of shift, the LPN needs to, depending on the circumstances, transfer the care of the client to a suitable care provider or provide their employer with reasonable notice so a suitable care provider can be arranged. A suitable care provider is another person who is authorized and competent to provide the care that was agreed upon. The definition of reasonable notice can differ depending on the situation. LPNs need to collaborate with their employers to establish what constitutes appropriate notice based on client risks, the availability of resources, and other relevant factors. Abandonment of care can result when the LPN fails to meet these requirements, and this may lead to a complaint of unprofessional conduct. Here's an example of abandonment of care. An LPN is the only nurse on shift overnight at a Type B care home. She is supervising 2 experienced, competent HCAs. Their care assignment during the night shift involves responding to bells and supporting clients with other basic needs. Once she believes that the clients are asleep, she and the HCAs all take a 15-minute break at the same time. In that time, a client calls for assistance, but the LPN and her coworkers can't hear the request for help from where they are taking their break. As a result, the client is left waiting for care. The way that the LPN managed breaks in this example led to abandonment of care. By allowing all staff to go on break at the same time, the LPN failed to arrange for transfer of care to a suitable care provider. Even if clients were only left unattended for 15 minutes, this is still abandonment of care. None of the providers in this example were able to hear a client call, meaning the client would not have received the care that they needed. Now we'll look at expectations related to professional boundaries. LPNs have professional knowledge, skills, and understanding that clients rely on for their well-being. They use their clients' personal health information to help achieve better outcomes. They're also often with their clients during vulnerable periods. All of this places LPNs in a position of power. LPNs have a responsibility to maintain professional boundaries. Appropriate boundaries build trust and respect, keep the focus on health-related treatment goals, and ensure that health professionals do not take advantage of the power that they hold over clients. Actions that don't align with these boundaries, such as providing care outside of the care plan or seeking the client out when not at work, can compromise an LPN's ability to provide safe, quality care. Let's look at an example. An LPN is employed as a home care nurse. He visits one of his clients to provide wound care on her foot. The LPN notices that his client is having difficulties getting around. She's not able to keep her house clean, so the LPN helps by vacuuming and doing the dishes. He runs a few errands for her and drives her to some appointments outside of work hours. The LPN does not document or otherwise report any of these extra tasks to the rest of his client's healthcare team, believing it is not relevant to client care. By assisting the client outside of the assigned care, the LPN in this example is crossing professional boundaries. He has been given a specific care plan, which has been developed by the healthcare team to best meet the client's assessed needs. Changes in the client's capabilities, for example, the ability to keep her house clean, need to be reported to the healthcare team. Proper notification helps the team get the client any other support that she might need and alerts them that her condition may have changed. In this case, the wound on the client's foot may have impacted her ability to keep up with her day-to-day activities. In this example, the LPN is also building a personal relationship with the client by helping her outside of work hours. This creates a scenario where the LPN could take advantage of the power that he holds over his client, for example, by receiving gifts. Prioritizing a therapeutic nurse-client relationship will make sure that the LPN can do what he's there for, supporting the client in meeting health-related treatment goals. For more information on professional boundaries, please visit the Knowledge Hub on the CLPNA website. Finally, let's look at privacy considerations related to social media use. LPNs have a responsibility to use social media and other technology in a professional manner. They are expected to respect client privacy and confidentiality in their social media use. This means not sharing information about clients. It also means taking steps to preserve professional boundaries. Here's an example of inappropriate social media use. An LPN posts a video that she recorded at work to her personal social media account. The video shows the faces of several clients and coworkers, as well as signage that indicates where the LPN works. The LPN posts the video with multiple hashtags, which means it can be viewed by users who are not on her followers list. The LPN in this example did not use social media appropriately. She violated the privacy of her clients as well as her coworkers. The video contained enough information so viewers could determine where her clients were located. Revealing a client's location may jeopardize their safety. It may also enable the viewer to guess what conditions a client was being treated for, which violates their right to privacy and confidentiality. Even if the LPN's profile was private, she still shared the video with everyone on her followers list, which was itself a violation. By using hashtags, she also shared the video with a wider audience. It's possible that some of the people who viewed the video were regulated health professionals. Remember that health professionals are required to report the video as a violation of confidentiality and privacy. In this video, we've covered many of the key topics that can be found in the CLPNA's policy on professional responsibility and accountability. There are several other subjects to explore within this policy. These include privacy and confidentiality, fitness to practice, professional development, and duty to report. We encourage you to take a look at other resources on these subjects. Thank you for the interest you have taken in this important topic. Licensed practical nurses are regulated professionals who are committed to providing safe, effective, compassionate, and ethical care to members of the public. To do this, LPNs are required to consistently maintain and enhance their competence in nursing practice and be aware of strengths and areas in need of improvement. Please use the Ask CLPNA link on the CLPNA website to submit any questions you may have with regards to this video presentation.